Occupational English test. Listening test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information that you hear. Now, look at the notes for Extract 1. Extract 1, questions 1 to 12. For questions 1 to 12, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Good morning. How can I assist you today?
Good morning, doctor. I've been having these patches on my skin that are red, itchy, and covered with silvery scales. I'm quite concerned about it.
I see. How long have you been experiencing this?
I first noticed them about 3 months ago, but they seem to be spreading and becoming more prominent recently.
Which areas of your body are affected by these patches?
They started on my elbows and knees, but now they're also on my lower back and scalp.
Are these patches always itchy, or do they sometimes become painful?
They're mostly itchy, but sometimes they do feel sore, especially when I accidentally scratch them.
Have you noticed any factors or triggers that might exacerbate the condition, like stress, specific foods, or environmental changes?
Stress seems to make it worse. I've also noticed that the patches get more inflamed after I have a hot shower.
Do you have any other health issues or conditions?
I've had occasional joint pains in my fingers, but I thought it might be due to overworking.
Interesting. Have you ever tried any treatments or remedies for these skin patches?
I've been using moisturizers and some over-the-counter creams, but they provide only temporary relief.
Do you smoke or consume alcohol?
I drink occasionally but don't smoke.
Any family history of similar skin conditions or other autoimmune disorders?
My mother had similar patches, and she was told it was psoriasis.
Based on your description and family history, it does sound like psoriasis. However, a proper examination will help confirm this. Looking at your records, your blood tests indicate elevated inflammatory markers, which can be consistent with psoriasis. Your skin's physical examination shows thick, red patches covered with silvery scales, typical of plaque psoriasis. Do the patches on your scalp cause dandruff-like flaking?
Yes, doctor, it's been quite embarrassing as it looks like severe dandruff.
I understand your concerns. Psoriasis is a chronic autoimmune condition that can be managed effectively with the right treatment. I'm prescribing a topical steroid cream to reduce inflammation and itching. Additionally, a medicated shampoo for your scalp will help control the flaking and itching. Given your joint pains, I also recommend seeing a rheumatologist, as some people with psoriasis can develop psoriatic arthritis.
Thank you, doctor. Is there anything else I should be aware of or any lifestyle changes I should make?
Keeping your skin moisturized will help. Avoiding triggers like stress and reducing alcohol consumption can also benefit. Remember, while there's no cure for psoriasis, with proper care and treatment, we can manage the symptoms effectively. Regular checkups will also be essential.
I appreciate your guidance, doctor. I'll start the treatment and schedule a follow-up visit.
You're welcome. Take care, and if you have any concerns or worsening symptoms, don't hesitate to reach out.
Extract 2, questions 13 to 24. For questions 13 to 24, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Good morning, Dr. Lewis. I've been referred to you because my family doctor suspects I might have emphysema. I've been struggling with shortness of breath and a chronic cough lately.
Hello, Mr. Thompson. I'm glad you came in. Emphysema is a type of chronic obstructive pulmonary disease, COPD. Tell me, have you been a smoker?
Yes, I smoked for about 30 years, but quit around 5 years ago.
That's good to hear that you quit. Emphysema is often linked to long-term smoking. How often do you experience shortness of breath?
It's been quite frequent, especially when I try to exert myself. Even simple tasks like walking upstairs or carrying groceries make me feel winded.
I see. And the cough you mentioned, do you produce any sputum or mucus?
Yes, it's usually clear or white. Sometimes there's a lot, especially in the mornings.
Do you have any history of frequent lung infections or other lung diseases?
I had pneumonia twice in my life, and when I was younger, I used to get bronchitis quite frequently.
Noted. What about your family history? Is there any record of lung diseases, particularly emphysema, in your family?
Not that I'm aware of.
Okay. Given your history and symptoms, we'll need to run some tests to confirm the diagnosis. We typically start with pulmonary function tests to see how well your lungs are working.
What do those tests involve?
We'll measure how much air you can breathe in and out and how fast you can exhale. It helps us determine any obstruction in your airways.
All right. And when will I know the results?
Usually within a few days. Depending on the results, we might also suggest a chest X-ray or CT scan to get a clearer picture of your lungs.
I see. If I do have emphysema, what would the treatment options be?
Treatment aims to relieve symptoms and slow the progression of the disease. This could include bronchodilators to open the airways, inhaled steroids to reduce inflammation, and oxygen therapy if your blood oxygen levels are low. In some cases, pulmonary rehabilitation or even surgery might be options.
Will I need to be on medication for the rest of my life?
It's likely yes. Emphysema is a chronic condition, and while we can manage the symptoms, there is no cure. But with the right treatment and lifestyle changes, many patients lead active and fulfilling lives.
Thank you, Dr. Lewis. I appreciate your thoroughness.
It's important to understand your condition and the options available. We'll work closely with you throughout. For now, let's schedule those tests and go from there.